The ProSim 4 is part of Fluke Biomedical's future of patient monitoring testing. The ProSim 4 is uniquely purposed for and designed for the purpose of doing a rapid response evaluation of a patient monitor. For example, the monitor is a problem, is not working properly. The nurse or the doctor in the clinical unit calls the biomed department to please come up and look at this patient monitor and see whether it's working or not. The biomed brings the ProSim 4 to the location of the patient monitor and simply turns on the patient monitor, makes sure that the ProSim 4 is connected in place of the patient, which we have already done, and then at that point the time starts. We believe that you can do a go-no-go assessment of the patient monitor within 60 seconds. So we've responded to the cry for help from the clinical unit. We've responded, come up to the unit, we've connected our ProSim 4 in place of the patient. So ECG is connected, NIBP, an invasive blood pressure line, and we're ready to start. So because we think we can do this in 60 seconds, I'm going to set the countdown timer to 60 seconds and we'll begin now. I will choose IBP and 0. And now what I want to do is dial up my invasive blood pressure, 0 it. As soon as it tells me it's zeroed, then I can continue on. Back to home, hypertensive patient, start an NIBP reading. The alarm is sounding, and I'll silence the audible here just so we can talk over it. But the point is that we have triggered an audible and a visual alarm. We're measuring a blood pressure reading. We can already see that our simulated parameters of 120 beats per minute for heart rate, invasive blood pressure of 200 over 160 is already being displayed. We have good waveforms for normal sinus rhythm at a very high heart rate. And when the NIBP is finished, when we get our cuff blood pressure, we're done. Done. We have completely assessed a go-no-go of this patient monitor. We've seen audible and visual alarms. We've seen that our heart rate that we're simulating is exactly the heart rate being displayed. We see the ECG rhythm is the rhythm that we're sending. We see the invasive blood pressure channel that we're sending blood pressure information across shows the right values and a good waveform. We're seeing that the cuff blood pressure reading is exactly what we were simulating. And all the alarms and everything, this gives us a pretty good determination that there's nothing wrong with this patient monitor. The power of a simulator as simple as the little ProSim 4.